Hi everyone, thanks for tuning into this video. This is a special video because I have my husband here with me, John. And John is a registered massage therapist, and he's going to be our expert on this video when we're going to be talking about how weight impacts physical pain in the body. So I first want to start out because this topic came up from a viewer who submitted a question to me, and I'm going to read the question that she sent me because I think a lot of you will be able to relate to this question. So she's saying she's experiencing a really prominent problem right now, and she's noticing that none of the health at every size people who she follows on social media, listens to in podcasts, are addressing. And she's saying that she's in her mid-50s, and for the first time, her weight has become a genuine health and pain issue. So before, any of the discomfort she was feeling around weight on her body was more experienced around appearance, stigma, weight bias, etc. But that as she grows older, she's noticing that being heavier actually hurts in her body. So her hips hurt. And she says, I know it's from my weight because on the occasions when I've been less heavy, the hip pain has disappeared. And this was over a span of 10 years. And she says because her hips hurt, she's not exercising as much, which then has a negative effect on her well-being in general. So walking feels really hard, as though she's like carrying a heavy load, which she says, in a sense, I am. And she also has arthritis in one knee. And she says, I know very well that thin people get arthritis too, but they tend to get it later in life. And the degree of arthritic pain, she is saying she believes that at her age is less in lighter people. So she's saying this is all very difficult for me. She wants to embrace health at every size and intuitive eating, but the reality is that if she restricts food and becomes lighter, it's much easier to move about in the body with less pain. And she says she really hates that health at every size coaches and thought leaders seem to be ignoring this uncomfortable fact because of a focus on younger bodies. And so she was saying actually earlier, and I didn't quite read it in the beginning, that she's noticing also when she sees people on social media and podcasts, they seem to be talking more to and about people who are in their 20s and 30s, and she's older. So she says, I have to face up to the horrible fact that there's very real physical disadvantages of being fatter when you're in your 50s and 60s and beyond that aren't just about how we are seen or how we view ourselves. She says, my struggle is real and I don't know what to do. So firstly, I just want to thank her so much for sending in this inquiry. It's really important question. It's very real, and a lot of people struggle with it, and it's a big limitation in a big source of anxiety and resistance for people wanting to follow a health at every size approach and intuitive eating. So with John here, he is our sort of anatomy expert. He has been trained in the anatomy, and he works every day with people on the massage table who come in of all different sizes, of all different ages, and with all different pain issues. Yeah. So I'm going to ask John some questions, and the first thing I want to ask you is, does weight gain cause physical pain in the body? Because a lot of people, what they're experiencing is they gain weight, and then all of a sudden they're experiencing either back pain or knee pain or joint pain. So can you talk more about if weight gain is what causes pain in the body?
Right. Well, hi everyone, first of all. I have to say the short version of the answer is no. It's not really the weight. And let me elaborate a little bit on that. first of all, when people imagine that, like, oh, the weight, because now I weigh more and now things hurt. A lot of the comparisons I've heard over the years is people who, for example, put on a backpack and suddenly they have 15, 20 kilos more in their back, and their back starts to hurt after walking with it for 10 minutes or 20 minutes or half an hour or whatever. And so, oh yeah, like the weight really impacts and really causes pain. But that's not the way body weight works. Like, you don't just gain 20 kilos from one moment to the next. And the important thing is to remember that the body really adapts, and pretty much all the tissues in the body are alive and they're designed to become stronger. So if you use your muscles, your muscles become stronger. When you put your bones under stress, they become stronger. It's called Wolff's Law in the case of the bones. So that's something important to consider. When you gain weight over time progressively, your tissues become stronger, like your muscles, your bones, your structure becomes stronger to carry that weight. So it's not the weight itself that is causing pain. However, there can be some background issues. For example, if one of your muscles that helps you walk is not working properly, you're gonna feel it more if you have more weight on your body, because the issue is still there, and you are still gonna feel it even if you have a thin body. But you may feel it a little bit less, and it may take a little longer to develop, but you'll still have that problem. So you need to work on strengthening that muscle and really doing a targeted treatment with a physiotherapist or a massage therapist or somebody who knows what they're doing to have your body work in the way that it's supposed to. But it has nothing to do with the weight. I feel like there was another point that I wanted to touch on, but... So
just to, like, as an example, I'm thinking of if I had, and this is like a painful example, but we're talking about pain. Say I had like a nail and I was like pressing it against my skin. The weight isn't what's causing the nail being there, but more weight is going to press it deeper into my skin. So I'm going to feel it more. So it's like the issue is that there's a nail on my skin and it's pressing into my skin.
Right.
And if I'm thinner and lighter, I'm not going to feel that nail as much. But as soon as I put more pressure on it, I'm going to feel it. And so I'm thinking it must be the weight that's causing this pain.
Right.
But no, really it's the fact that I have a nail.
Yeah.
So, excuse me. So what would you... Okay, so then, she's also saying... Well, and then I have more weight, I feel the pain more, and so now I don't want to exercise. Like I and then that of course affects mental health and just a general sense of well-being. Right. So so your recommendation is then to find out what the cause of the pain is. Weight loss may provide relief from the pain, but it's not going to cure the pain.
No, it's not going to address the cause. The other thing that I feel is important, like exercising, in general, movement is very important for the body. The body thrives on moving.
Go ahead.
And not being static for a long time really hurts the body. We're designed to move, and even like I don't know the person who's writing, and I don't know what kind of exercise she was doing. But maybe trying to find another way of moving your body can be a really good way of reintroducing movement. And that is going to help bring some relief when it comes to pain. I'm sorry, I digress. What was the question?
Okay, it was just more how people can start to alleviate the pain. Like if they don't want to exercise, and if exercise is going to help, and what do you do?
That's the thing. Try to find something that, even if it isn't traditional exercise, moving is important. Try to find ways of incorporating movement in your everyday life. That is going to keep your joints running.
But what if it's hard to move? Like you don't want to move now because you're in so much pain.
Right. But that's the thing. pain is, unless you're just sitting and you're in pain, then you go to a doctor, like.
And now what if the doctor says you got to lose weight? Because
Right.
the doctor always says you have to lose weight. So here's another
Find a haste doctor. Find another doctor.
Probably a frustration though is that even doctors who we assume are experts in anatomy
Right.
will even say that's not their strong suit. So even they're under this false idea that weight causes joint pain and arthritis and these issues.
Right.
And so they're even under this false assumption.
Right. So, honestly, with this, I would take a recommendation that I heard you give once. I think you did it in one of your videos. You're like, okay, asking your doctor, if I was in a thinner body, what recommendation would you give me? Something like that. If you can't find an actual haste doctor or somebody who actually is willing to look at the actual issue instead of just blaming it on the weight.
Because I remember, this is just reminding me, Linda Bacon, who's the author of Health at Every Size, actually shares a story where her and her father both had the same pain issue. And her father was in a larger body. And when she went to the doctor, she was like prescribed certain, movements or told to go to physio or like these, she was basically... The issue, or what was recommended, was to address the issue at hand. It was given proper treatments.
Right.
But her father was told basically to lose weight.
Right.
So, and I think that's where the confusion comes in, is that you lose weight and you feel less pain. You do. And so then you think it must
Right.
be the weight.
But wait 5 years. Like if you were able to artificially keep your body small for 5 or 10 years, you would still be at the end the end of 5 or 10 years, you'd probably still be back feeling that pain.
So then it comes down to taking measure to firstly address the pain. So going to see like a massage therapist or a physiotherapist, so to strengthen the joint.
It could be, it could be an issue of a muscle that's not, it could be 1,000 different things. It could be an issue that's a muscle is not firing, a group of muscles is too short and they need to be stretched out. We don't know. Like it's a case by case.
But so the recommendation would be though to treat the cause and then take the effort to maintain it by keeping the muscles strong. Because as we age, we're less likely to be mobile in general. Like we're not, and we've also probably had years and years and years of either repetitive motion from a particular job that we're doing or sitting at a desk or at a computer. So we've also built up these issues over time. So another question.
Can I make one comment about this? I'd say
about. Yeah, you can.
I'd say about maybe 95% of the people I see on an everyday basis, and I work 6 days a week in clinics, is postural issues. 95% of people come because they're in pain with things that they develop because of their posture. They work at a computer and they're like this every day, all day, or they work standing up, and so they're kind of like putting their butt out and they're back in such a way that, if you do that for 8 hours a day, it's going to hurt.
So another question I have, and a point that she brought up is, like she was saying, well, people that I know who are thinner, who are my age, don't have arthritis as much as people who are heavier. So that's her experience. What is your experience, who you see I'm assuming a variety of different people in different body sizes, different ages, like kind of what's your overall experience of pain and body size and age? What do you see, any patterns or like?
I mean, I can't really, I can only talk about my experience. I can't really speak to the research. I haven't really looked into that.
But let's also remember too about research is that it's done within a weight-based paradigm. And
there's probably...
So we have to also just notice, like, when there is research coming out, I will just take this moment to say that none of the research can prove that weight is the causal factor of disease and pain.
Right.
They're showing a correlation and association. Yeah. So, and also what's happening too is there's a lot of bias. So people are more likely wanting to prove or doing research that's like coming up with a conclusion that weight is the issue, and sort of ignoring the other research that's not. But anyways, sorry, I digress. I just want to make that point about research. But in your experience of seeing many different bodies and ages on the table, what do you notice?
Like really, I've seen a lot more thin people with arthritis than I have seen people in bigger bodies with arthritis, to be honest. I see a lot of people in, I think the youngest person I ever treated that had arthritis was in her late 30s. But, of course, I see more arthritis in older people just because it's a disease that tends to progress over time. And so I saw a lot of people in their 60s with arthritis and in their late 50s with arthritis. But I see more of a correlation between age and arthritis than I do between body size and arthritis. Yeah.
Yeah. So I think to this viewer's point, I think a lot of health at every size people on social media and on podcasts are not addressing it because they are, yes, they do tend to be speaking to younger people or tend to be younger themselves. And I think it also has to do with that social media tends to draw in a younger demographic. So we're seeing that posting more on social media. But, you're not the only person I've heard talk about that structurally, like the pain in the body is not caused by weight, but weight can exacerbate the feeling of the pain because, again, it's like that analogy earlier. It's the nail pressing against the skin. The issue is the nail, not the weight that's pressing on it. So we have to remove the causal factor, and then you'll feel less pain. But again, just because you're feeling an alleviation of pain if you lose weight does not mean that it's structural.
Right.
So is there anything else that you want to kind of share from your perspective as a massage therapist on kind of postural health and or body health and size? Like anything that you want to share about that before we wrap up?
The biggest thing, if I could make one suggestion to everybody, like if I could leave you all with one thing, would be to move. Like find ways of moving that are pain-free. So even if you are in a lot of pain, but it doesn't hurt to lift your arm like this, just do that. Find ways of moving that are not painful, and start there. Movement is really good for the body. Rest is also really good. On the other hand of the coin.
I'm sorry, I'm gonna just cut you off only because it spurred my mind right now. Is I think in our culture we're so focused on intense movement and a lot of movement for a long period of time, and we have this belief that only like that certain movement doesn't count if people don't sweat or if it's not in a particular intensity. So what would you say to that?
Movement is better than no movement. Intense movement is not inherently better. It depends what you're trying to do. And certainly if you do anything intense, you need to kind of like counteract it with a more intense rest or longer rest. So for example, if you are, I don't specialize in bodybuilding or powerlifting, but if you are lifting a lot of weight at the gym, if you just broke through your personal limit and lifted extra weight, you need to take extra time to rest after. You won't be able to go back to the gym with the same regularity you used to. You need to take an extra, I don't know how many days than you usually do, just because the proportionate effort, your muscles need more time to rebuild. And that's the thing, what happens with intensive exercise. And so if you do intensive exercise after intensive exercise after intensive exercise, you're not giving your body enough time to rest. And that is gonna end up causing problems.
And so like we kind of are talking about something a little different than what the viewer was originally asking about, but that actually a lot of source of pain in the body can be caused too from overdoing it with exercise, and that's a real problem in our culture today, especially like the fitness culture.
Yeah, I mean, there's one big category of injury is overuse injuries, and a lot of postural dysfunctions usually come because some kind of overuse. Like if you're holding a posture for too long, some muscles are overworking. And so that is one kind of problem that can come from overuse, or one kind of category. But in this culture, when we're addicted to kind of like the power exercise, then you get exacerbated overuse, especially on some muscle groups. That we get a lot of like flexor deformities and kind of like people that are overworked in their chest and their back, and they're rounded, and it's just basically I'm more of a proponent of gentle movement. At the end of the day, what we care about is your ability to move through your day feeling good in your body and feeling healthy, and be able to do that for as many years as possible. Like eventually age will, we'll all feel the effects of age. There's no way around that. Even if we do start feeling them at our 90 years old. However, the point is not to work ourselves out. The point is just to be able to enjoy our life. And exercising intensely for long periods of time I don't think is helpful, unless you're exercising for a very particular purpose, like breaking a record or something like that. And then you're resting,
for like days.
Yeah, for like days or months.
Yeah.
Anyways.
Good. Well, I think that to kind of wrap it up and to recap what we talked about, weight isn't the cause of the pain. It can make the pain feel worse. But it won't cure the cause of the pain.
Yeah.
So the thing is about addressing the root cause of the pain, and then knowing that the body will end up supporting the weight. The only other issue where I would say one caveat to this is where weight might cause pain is if, say for example, the weight is gained really quickly. So like maybe somebody's taking a medication, and over the course of a month, they've gained like a significant amount of weight. Could that be a potential?
Well, it could be at first. However, the body will still adapt.
It will still adapt.
The thing is, if it causes any type of physical injury that is not addressed, then the pain may linger, but the body will adapt.
Okay.
And it should be able to adapt in a healthy way for the body.
Okay.
But if the only thing would be if during that month or that small period of time where there is a lot of increase in weight, if it causes any kind of like muscle tear or ligament tear or anything like that, that is not addressed, then that may linger in the coming months.
But then again, it's still not the weight loss that's going to cure it.
No.
Okay, and the other point was movement is good.
Yeah.
That actually gentle movement is more of a preferable way of moving than super intense movement. And if you are going to do super intense movement, you need like equal amount of rest, which usually people are not getting.
Yeah. The other small asterisk I wanted to add about the movement is even changing your posture. So if you're working a lot in an office, which most people do nowadays, or not in an office but in a computer setting where you're using a computer for many hours a day, just setting a timer to get up from the computer and move around a little bit, it's going to make a huge difference in the long run. Yeah.
Well, I hope that video was helpful, and I want to say a big thanks to my hubby for taking time to, to
thank you all for
on.
listening.
Yeah, to be the expert. And so, yeah, I hope that helps to alleviate any fears about taking a health at every size approach or doing intuitive eating. Because it again, it's we in our culture blame weight for everything, and it's really not the cause. And so when we can start to move away from a weight-based paradigm of health and how we view bodies, I think we'll be all better off.
Yeah.
So if you have a question that you would like to see addressed in an upcoming video, please I will have a link below, a Q&A link below that you can submit the question. I will also have a link to download my free body acceptance jumpstart guide. If you haven't already got your copy yet, it's packed with different resources. And that's it. Thanks so much for watching, and hope to see you next time. Bye.
Bye.